to everyone, particularly to our distinguished panel, who's going to be sharing a lot of insights and be able to absorb some of the questions and issues and problems which are very much paramount in so many of our minds. Otherwise, we'd be here. So I'm here representing the Laurel Foundation with Dr. F.O.R.C.E, who's on the board of directors, and our pleasure has been to support the project that Andy Iarocci is doing in the supervision. And it's a project which is going to be discussed in detail today, one which we're very proud and pleased to be able to support. The Laurel Foundation has been around since 1988 and is geared to support support people who have the problems and issues in the field of mental health and specifically today in the field of autism. So without taking more time, thank you for coming and welcome. And thank you to our panelists for gracing us with your knowledge and information and capacities.
Thank you, Paul. Welcome everyone and thank you for coming on a weekend. I know that's an extra effort that people have to make. We've been really happy with this series. I think we've got a lot of feedback from the families, from professionals, and individuals with autism about these events and the importance of these events. So we're really happy to have been supported by the Laurel Foundation. So just to set up the ground rules, I think it's important to keep our comments solution focused because that helps us move forward in the discussion and think of ways that we can maybe even prevent mental health problems and support families. You can direct your question to anyone on the panel or to the whole panel as a group. We also have questions that have come through email. So what we'll do is we'll alternate from people here as well as people who sent us their questions through email. We are filming the event, and this will be put up on our website for those who couldn't make it, and also for those of you who want to share it or who want to review it again. We are very lucky to have additional panelists who weren't advertised, Pam Collins and Louise Witt, and they'll tell you a little bit more about themselves. Okay, so I will leave it to you, Emily.
Okay, hi everyone, thanks so much for coming today. I'm a doctoral student in the Autism and Developmental Disorders lab at SFU, and as Colin mentioned, this family quality of life research is my dissertation project. So just to give a very brief background about these events and about the research, we held an event in April that just was about family quality of life and ASD very broadly. We didn't put any restrictions on kind of the topic because we wanted to see what issues were most salient, what came up the most. And those really drove the topics for this series. So we did schools about a month and a half ago. We're doing mental health today. And then we have one coming up at the end of March on transitions. So we've tried to select wonderful panels each time that can really speak to these issues and answer questions on those specific topics and really facilitate discussion with parents and professionals and individuals. So we're doing things, if any of you joined us in April, we're doing things a little bit different this time. We're trying to be very responsive to feedback that we receive. So we're going to hand out very short forms at the break, and we'd love it if you could just jot down your thoughts on how the day went, what was great, and what you would like different. And the purpose of the break is to give people a chance to network with one another, or perhaps talk to panelists a little bit more, as well as to have people participate in the study. So a bunch of you have indicated that you wanted to connect with me at the break and fill out the survey. So I will stand right at the front, and if you want to complete it at that time, you can just come up to me and I'll give you a survey. Otherwise, some of you have indicated you'd like to participate after, so I'll be sending you the link this week. And so the purpose of this research is to really hear from families about what contributes to their quality of life. So where they get feelings of satisfaction from and dissatisfaction. And the goal is to make recommendations to policymakers about how services can be better matched to families' needs. So I just want to thank all of you who have participated already, and those of you who have indicated you'd like to today or in the future. We really appreciate your contribution to this work. So I'm going to turn it over to our panel now. We'll start at this end and move forward. So they're up, and they'll each introduce themselves and speak to these issues from their own perspective. And then we'll turn it over to the audience, so you can, like Grace said, direct questions to a specific panelist, or ask it broadly, and they can kind of collaboratively answer your questions. So thank you so much for coming.
So do I just go ahead and start? Welcome, everybody. It's nice to see some familiar faces here, so thank you. I'm a parent of two very different thinking sons. One who is 19 with a variety of different ways of thinking, but he's an adult now and I don't have permission to discuss him. And I have a 17-year-old who was diagnosed with classic autism at the age of 2 and has been my ticket into this incredible journey that I am now on. I'm also a behavior consultant for Reach Child and Youth Development Society, which serves families in Delta, Langley, and Surrey. And I am here today representing the Family Support Institute, which is my volunteer joy in life. The Family Support Institute, in case you don't know, has been around since 1985. We have over 200 volunteer parents and family members across the province that you can connect with, or anybody can connect with. So if you have something that you have a concern about, you just call the head office and they will look into your community and they will find another family that has walked a similar walk and connect you, so that you can have an instant friend to go to meetings with or talk about strategies or different things. And it's quite unique. It's the only grassroots, family-driven, family-directed organization in Canada. So we're really lucky to have it here. And they put on workshops. They support all families with children of all ages into adulthood with all different diagnoses, including mental health. And I think my passion about mental health is that quite often families can have a child with diagnosis of autism, which often means that there's somebody else, somewhere else in the family that has mental health issues. And for me, it speaks to the resilience of these families, because not only are they dealing with autism, but they are coming to the table with other things happening. And even the child with autism might have mental health issues. And I know in my own family it's quite true, and I'm not sure if it's added to my resilience or added to the challenges, but I think it definitely speaks to the resilience of families.
Hi, thank you for the opportunity to be here today. My name is Louise Witt, and I'm here representing the ADDL Applied Behavior Analysis Network. And I also am the parent of a now 10-year-old boy who was diagnosed with classic autism at about 2 years of age. I also happen to have a background in social work and have worked in the mental health field, so it's kind of an interesting combination for me that all came together with my son and then with my work previous to that as a social worker. The ABA Support Network, we also are a grassroots parent organization, so it's 100% volunteer, parents helping parents, and what we aim to do is provide education and support for any family who's been touched by autism. We obviously believe in ABA, hence the name in our title. One of the things that's most relevant perhaps to today's topic is that we provide support group meetings. We try to do neighborhood support group meetings every month in a variety of locations in the Lower Mainland, and we're always looking to build those up. And that is absolutely crucial and really significant for today's topic, because one of the things we know is that when families have good support, they're much better able to deal with some of the mental health issues that may be that they may have to address. And as Pam said, people may be coming autism with a pre-existing mental health issue. It could be their own, it could even be the child who is eventually diagnosed with ASD. So we need to bear that in mind, and then when you put on top of that layer the whole world of autism, it's an interesting recipe for mental health concerns. I watched the YouTube video from last April, and a parent in the audience spoke up. I don't know who the person was, she wasn't on camera, but she had a fabulous quote that really resonated with me. And she said about raising a child who has ASD, it is stressful, it is utterly overwhelming, and it's lonely.
And it is what?
And it is lonely. And for those of you who are parents in the room, I'm sure you can connect with what that feels like. I know I instantly did. So I thought do I still have a minute left? Okay, she's not waving her arms yet, because I'm a bit of a talker. You know, some of the things that we need to consider as families, or the impact that ASD has on the entire family, on your marriage, on finances, on siblings who I believe are the unsung heroes in this whole field. What it means to have to deal with multiple systems, to tell your story over and over again, to be heard, what that's like, and how all of that just layers on, and that we have to cope with all of that, as well as coping with a child who is not the child we thought we were going to be raising, and who may have all kinds of different things that are going on in their home. In my son's case, we have a lot of aggression and self-injurious behaviors and things like that. And so piling that onto the stress of the family is a lot to deal with. So I'm really thrilled that this topic is coming to the forefront today. I see some nods from a lot of parents by the looks of things. So we're really glad that we're all here today to find out more about this and how we can cope.
Good afternoon, and I would like to thank the Laurel Foundation to make this event and the work behind it possible. My name is Tara, and I'm a person with Asperger's. I was diagnosed as an adult only a couple of months before I graduated from UBC. Fortunately, I was singled out in an eating disorder group and referred to Dr. Chernick, a noted psychiatrist who was then conducting a study on autism at UBC. So in many ways, I consider myself lucky to have started my autistic journal with a healthcare professional.
I'm Steve Cairns. I'm just delighted to be here. I have two hats to wear. One is with the F.O.R.C.E, and if you're not familiar with the F.O.R.C.E, go on to the F.O.R.C.E., which is a very similar organization. However, the F.O.R.C.E members, we call them parents and residents, have walked this path before. They've been down the road of dealing with society at large, with children or themselves with mental health issues. But they are paid, they're not volunteered, but so there's limited numbers of hours. They, to use the language of Newfoundland, come alongside with them. And they're supportive. So it's wonderful to see that we have this sort of echoing response to family needs. This is exactly what needs to happen. My experience as an educator and an administrator for 35 years faded out and became this part of my life, which was to work with the BC School-Centered Mental Health Coalition, which is a group of about 45 different representatives from universities, teachers, the psychiatrist organizations, the F.O.R.C.E, just everybody, Ministry of Health, Ministry of Education, Ministry of Family and Development, everybody's saying, you know what, we have to be able to get ahead of this. We need to be able to become proactive rather than reactive. And so much of the frustration that families deal with is what I heard here, which is over and over and over again. Well, we shouldn't be doing this over and over and over again. We should be able to get the ball rolling through, we believe, schools as the center of that community. And then from there, that expands out into the community at large. So we have a burgeoning population of retirees that are looking for a way to belong and to feel significant and to be able to live for themselves, to come alongside families. This isn't really rocket science. It's very intuitive. It's what human beings do. We attach. And if we look at a child and the child's family and realize that what they need is a village, they need support around them. Our job is to orchestrate that. Our job is to make sure that these schools, in particular, we think the schools that need to start there, first of all have to have the language and understanding of all of the issues that go on in families, not just a particular one, although today we're talking about a particular one. But from my 35 years of experience, this is just one of many. And it's a growing number that we don't even have letters for yet. So what our belief is to be able to go step back, become proactive in this by initiating the language of what it means to be a village. I'm not going to go any farther than that right now, but to be able to say that it takes all of us, to be able to come alongside of each other, to be able to help a family and a child and each other create a better society. So I'm really looking forward to questions that you have and talk about the successes that we've had, the challenges that we continue to have, but we're headed in the right direction. You're not going to be alone anymore.
My name is Vikram. I'm a child and adolescent psychiatrist. I've been working in the area of autism for the last 15 years or so here in BC, a variety of different levels, both from a policy level involved with the setting up the BC Autism Assessment Network. And in the last 5 or 6 years, much more interested in the issues that revolve around the boundaries between developmental problems like autism and mental health issues. And that's been more and more my focus. I'm going to keep my comments short, but I think the main, I think these things will probably come up hopefully this afternoon, are how do we bridge these boundaries between what is called developmental disorder and what is a mental health condition. And I think there's many arenas in which these boundaries or these bridges need to be built or developed. One of them I think is a psychological one. It's interesting, Grace said earlier, I think it was you were saying earlier, about how we can avoid mental health problems coming on if we do things. And even that concept of how mental health is something that can be avoided, or mental illness can be something that can be avoided if we do something now, is an interesting concept, and I'm not sure how that interacts with the reality of the science of what we know happens with children and young adults with developmental conditions. The other thing I think is, I'm very struck by is how much progress we have made in terms of addressing issues around stigma with autism. Where I remember when I started in this business, people would still call it we use the A word. We didn't want to share the autism word with a lot of times because it was thought to be too stigmatizing, too problematic, and really have come a long way. By contrast, mental health and psychiatric disorders remain quite stigmatized, and it always strikes me, even in the context of having a child with a developmental disorder, how much stigma still gets associated with additional mental health issues. I think the other boundary or bridge that I think has increasingly become evident to me is one of systems. Is that we have created these systems based on knowledge and science that's probably 50 years old, which have created pillars for services for developmental problems and for mental health problems. But increasingly we're appreciating the differentiation may not really be as clear as we had thought. And at the ground level, accessing these systems is very difficult. I'm sure many of you have encountered the situation of having a young adult or child or adolescent with autism and trying to find mental health services and finding out that there are a lot of doors that are closed because you have a child with a developmental diagnosis. And how do we bridge that as well? So I'll stop there and move on to the discussion.
So if you'd like, I'll start with a question that was sent in by email, and maybe that'll stimulate some discussions from the audience as well. Okay, here's an interesting one. So what is the pathway to obtain mental health support and treatment for comorbid conditions such as anxiety, depression, and social isolation, including diagnosis for a child provided with the ASD diagnosis? Generally, these comorbid conditions opportunities exist for treatment only in the higher density urbanized parts of BC? Who would like to kick that off?
Sounds like you'll
We'll be here all after. I don't really want to get them started. It's a very good question. I was trying to work out something of a pathway with Deborah Hughes, the executive director of ACT, and a similar sort of question came up about them wanting to have on their in their materials something that families could use to say, this is how you negotiate the pathway. And one of the things that came up out of our discussion is that there isn't a single pathway. There are dozens of pathways within the same city, within the same locale, and across the world. And part of that depends on how services have been developed in a particular area, like on Vancouver Island, as opposed to the lower mainland. Part of that has to do with expertise. I'm not sure the question about whether it's necessarily a rural, urban split as much in BC as much as it is culturally different. I don't have a good answer, but I think the first part, in terms of how one accesses the service, other than say, I think the first step is for awareness, is for people, parents and caregivers and people who provide interventions to children with autism to really be cognizant of the fact that mental health conditions, psychiatric disorders are the rule rather than the exception in autism. That most children will develop psychiatric disorders at some point in their life. And unless we anticipate that as a outcome, I think we're always going to be in catch-up and not be proactive.
Maybe I could just add a little bit to the color of that, though, is I think one of the desperations that comes through that email is where you get somebody that has a voice of experience. And I think we could probably, if I can say that F.O.R.C.E is an example of what these, the ABA support group and the Family Support Institute, there are parents who have walked this path, and they can give you a map of where they've actually gone and had the diagnostic efforts done, and the roads not to take, if you like. So the systemic approach is one thing, and there's lots of people around that will walk you through that approach without it saying, it has to be, here's point A and here's point B, and this is how you get there. It's not going to happen that way. There's huge lags of time and everything that can get in your way. But there are people, and I would suggest that you contact the F.O.R.C.E. One of these organizations, the Kelty Institute, is another phenomenal organization that has just a wealth of information of Kelty, K-E-L-T-Y, which is connected with the Children's Hospital. And the F.O.R.C.E. works through their parents and residents up there as well. I'm sure you guys are familiar with them. Huge amount of resources, all sorts of avenues for you to follow. And to me, the answer to the question, which was how do you go about doing that, is a systemic response. And you have to follow that response without a doubt. But survival says that we also need other people around us, just to be able to say, are we okay? Are we doing the right thing? Are we headed the right way? Am I okay? And you need somebody to be able to do that. And I think what the work that we've been doing, I'm hoping I can offer you a bit of an insight into the fact that schools are beginning to slowly turn that corner and not act as if this is something that they don't want to have anything to do with, and rather say, you know what, you're a part of this community, you belong in this community, we're going to figure out how to do this together. And we will build a support network around you. I think it's happening. I feel that it is, I know it's happening. So there's a systemic response, which all sorts of people will walk you through, but I think there's also a village response, a community response that exists in your neighborhood that we have to be able to build and harvest.
If I can just add to that, certainly within the ABA support network, that's been something that's been recently coming up time and time again with a lot of our members. And our meetings, like I said, very grassroots. We meet in people's living rooms, or we might rent a space in a local community center or something. And this idea of dual diagnosis or comorbidity, this is coming up, and part of it, I think, as Dr. Dewis said at first, is educating not educating the educators, but educating people who are working in the field that this is not the exception, that we should be expecting another diagnosis on top of ASD. And the other thing too is that parents do need to talk with other parents to find out. Sometimes you just think you're going nuts because nobody's listening to you, and you know something else is going on with your child. and connecting up with other parents and asking those parents for guidance, what to do, what has worked for you, what hasn't worked. Unfortunately, sometimes it's a matter of being the squeaky wheel. And until the system responds, has the pathway in place, unfortunately, many times it is being the squeaky wheel to at least find out, does your child have another diagnosis, and how are you going to tap into the services that may or may not be available for them?
Just sort of based on the question on your answers, when people are talking about sort of, you know, you'll find a community, people will help you. As a parent of a child who has both autism and mental health issues, I find the system severely lacking and a great deal of frustration with this sort of trial and error attitude towards finding diagnosis. I think that the province has come great steps as far as funding, as far as education, but I think that unless there's something put in early to let families know, to steer them towards those mental health resources, what you end up doing as a parent is trying to work through behaviorism, trying to work through the schools, trying to find funding, and somewhere along the way, you may have a mental health issue that's complicating any of those educational and behavioral issues that you may come across. And until you find that you can solve that mental health issue, you can be a parent that's, for lack of a better term, think you're doing all the right things, but it's still not working out even like it is for the families around you. And I think as parents and social workers and certainly teachers that I have worked with in the past 21 years, there isn't anybody you bump into who is qualified or who has had a look at your child. I mean, I think early intervention has come a long way in this province, and it's great. Not every child at 2 years old is going to show their mental health issues, but there is no provincial or government or some sort of check-in at older ages, because families are not going to find this on their own. Because when you're given a child with autism, you're trying to come up to speed on a very complicated diagnosis. There's so many options, there's so many people, you're hearing so many things. But mental health issues are health issues. Like all health issues, they require health professionals, they require a doctor. I still run into lots and lots of parents who have children younger than mine, who, like Louise was saying, you help each other, you hear other people's stories, but that's really not the way people should be finding out. There should be, and we again have to lose, like the doctor was saying, you know, there's the stigma around autism. You know, it means like the eggshell diagnosis. They didn't, when my son was 4, they didn't want to tell us. They thought we were going to fall apart. But quite frankly, we already knew before we got to Sunny Hill what he had. We just needed the diagnosis to get the funding. So again, now I think that parents of children with autism are going through a lot, but they're far more resilient than professionals are giving them credit for. You've already got the autism diagnosis and you hit the ground running. Somebody, somewhere, very early, I don't even care if it's a pamphlet. It comes in the package that says, you know, go find your behavior interventionist, go find the activist, go find this, that says you should be looking at mental health resources just in case. Because families aren't going to come up with that on their own, because they don't know until you do a ton of reading in your years in. I'm going to stop talking.
Can I just follow up? I mean, I think I resonate with almost everything you said. I think one of the things that we have seen, not just in BC, but across North America, across the world in the last 15 years, is this remarkable expansion of resources and capacity for delivering early intervention. We were not doing this 15 years ago. And we have, in BC, because of the model of how this has been rolled out, in particular, we've created a private marketplace of providers with some very focused areas. Now, what ends up happening is when you develop something in the early stages, you train people to use hammers. And when you have hammers, the phrase is, everything looks like a nail. And going beyond that and knowing that there are other tools that they can use is going to, it's a evolutionary process. And I think we are now at that point where I think people are, like yourselves, are starting to say, hey, what about the mental health issue? part of it, I think we were waiting for this early cohort that we've been identifying really well in the last 10 years, which we weren't before, these numbers, to age into adolescence, which they are now, and to present with these problems, which they are now, and for people to say, the old tools are no longer efficient or effective enough for my child, and we need to look at new ways of doing it.
But I'm not even necessarily saying necessarily old tools versus new tools. What I'm saying is, and I always say this right about my son, he is not the average parent.
They're not,
So behavior interventions, specialists that might deal well with someone who has autism, but doesn't necessarily have mental health issues like my son, can't begin to know how to treat him. And yet there's no filtering process early on. Because there are professionals who can deal with both his mental health issues and his autism and give him very specific treatment that has made a huge difference. But filtering through service providers, bumping their way through, running into parents, hearing when they're, years ago I remember going to a meeting, more than 10 years ago, there was a group of families and there was a doctor who had come up from the States, the UCLA program, and he started talking about how sometimes in adolescence, people with autism can develop seizures. And the room went silent, and it was like people were going to fall out of their chairs. Because honestly, there was myself and only one other parent who knew that, who had read it somewhere along the way. So that's what I'm saying, there's this floor falling out from you again, that you may not be going down the right road to find what you need. But somebody, somewhere early on needs to say something. Again, so now it's okay to say that your child has autism, but to say that your child has autism and mental health issues is again, VHL diagnosis.
So do you think, I'm just going to say, so do you think it would be better to put because we only have so many things that, well, resources, right? So if we put the resources toward educating families, do you think that would be a better solution than, I don't know, educating professionals or where?
I think you have to educate everybody, doesn't it?
Yeah, I think where we see like MCFD, we see CYSN, and then we see child and youth mental health, and they are very, in my experience, very deficient in the autism aspect. And they don't like to tackle that as well as a mental health condition. And they feel overwhelmed, I think, with the whole, the complexity of the child. And they literally look to the parent to go and find a more appropriate solution, perhaps in the marketplace, because the public support capability is simply not there. And that can be compounded if the schools are not sufficiently trained, certainly in the autism aspect. From the school psychologist perspective, if again they push back on the parents and essentially seeking answers from the parents rather than using hoping skills that they really need to help that child through both home and school life.
I would agree with that, yes, as far as a parent, but just both comments, but the comments that the ministry and the mental health, as the parent said, until it gets extreme and you're going to mental health because your son is, in the psychiatric unit, or they've had to, he's gotten that bad that his services aren't available till he's in the unit, and, and that's where the frustration is for us as a parent, but that's very true, I think. The mental health, that's their job, and we're not really supposed to.
Even tackling things like social anxiety,
which is
standard CBT and psychopharmacological products, seems a million miles away from my experience in dealing with child and youth mental health.
Yeah, there's that, when we start.
So where does a parent turn to get this the skill level of the door in order to steer the family towards a more appropriate solution? So we have the F.O.R.C.E list, which is great. We have a lot of highly qualified BCBA members, etc. there. Where's the equivalent in the mental health field, so that parents, when they get a diagnosis of autism plus an unknown mental health condition, and I've seen that, where do they turn to on that mental health condition? Like you say, it's a very complex pathway to achieve any sort of response.
It's very individualized.
Yes, it is, yeah.
And the advice I would provide any particular parent depend on who their doctor is, whether they've asked their pediatrician, who the pediatrician is, where they live, whether they've asked to mental health, which mental health team it is. I mean, there's all these little things that you know from being in the field. But, and you're absolutely right, the level of training is very good. And the attitude is often from CYMH is autism, this is way too much for us. And from CYSN, this psychiatric stuff is way too much for us. And then the parents like, well, I don't want to live with
Where
this.
do I go? Yes.
So,
There's a gentleman.
Sorry.
so Colin had wanted to make a.
Just a question, and that is looking at it from a systemic perspective, we're seeing terrifically committed, efficient, well-organized groups in the community which provide this type of support. Has there been any thought to either cross-linkage of information between them so that we're not in our silos? And going further, is there any interest in organizations and professions to be sharing data, looking at metadata, all that stuff together, so that families can have some indication as to okay, this is happening here, etc. Because it seems as if it depends upon who you talk to, where things happen. If you're lucky, terrific. If not, you're not. So just a question, from a systemic perspective, are we ready? CFD, MSL, ADA support group, F.O.R.C.E, etc.
Compiling or bringing together information.
Yes. So I have kind of perhaps a practical question. I guess the question that I wonder about is how early